Today we will review the application of the 350 below knee amputee rigid dressing by RCAI. First, we will take the waist strap off and put that to the side. Then remove the distal protective cap and put that to the side as well. At this point, we want to check the hinge for range of motion. If you have certain range of motion limits that you want to set for your patient, this is where you want to do it. At this point, I have it set for 30 degrees minus extension and 0 degrees extension, or full extension. It will come from the factory with the spring screw engaged at 0 degrees, or full extension. On the other side, I only have the range of motion limit for 30 degrees. I don't have it set for 0 degrees. So if you have a concern of your patient needing protection against the recurvatum or hyperextension position, you can use the set screw at 0 degrees to block any further movement in that direction to maintain that protected full extension protection. At this point, we're going to prepare the straps. We'll unfold the straps and lay them over to the side on the distal cuff. I'm going to loosen these two straps, and then move these two straps. By loosening these two straps gives me extra room to remove the anterior plate and fold it over to the side to allow the sock liner to be easily removed. Both posterior and the anterior cuffs have hook patches on both sides, which is designed to keep the sock liner in place. To prepare for application to the patient, we open the sock liner. In preparing for your application, typically as a practitioner, you would ask the patient to lift their leg. And if they needed help, you could assist with one hand, using the other hand to gently slide the sock liner in place. At this point, slide the sock liner underneath and in place. You want to make sure the patella buttress is inferior to the patella over the patella tendon and that none of the hook and loop is in contact with the skin. I've had questions as to how tight this needs to be, and my answer is as snug as it needs to be without putting the patient in discomfort and to the patient's tolerance level. At this point, we're ready to put the brace on. So again, we ask the patient to lift their leg, and as they do, we slide the brace in place. Now that their leg is completely in the brace, make sure that everything lines up and the axis of motion of the hinge lines up with the axis of motion of their knee. We then fold the anterior plate over the residual limb. It appears I need a little bit more space, so I'm going to loosen up these straps and realign the anterior plate. Now we gently snug the straps down. Because it is a bivalve cuff, it's going to give very even circumferential pressure, so it doesn't need to be that tight, just snug enough to minimize movement inside the cuff. Now that we have the brace completely on the patient's leg, we want to make sure that everything lines up and all the straps are snug in the proper place. And now we'll put the protective end cap on the patient in place, then the waist strap. The easiest way to do this is likely with the patient in long sitting. Then wrap it around the patient's waist and apply the straps accordingly, with encouragement to the patient to adjust them as needed. And that's how you apply the RCAI below knee amputee rigid dressing.